Good evening, everyone, and thanks for joining us tonight. This is Congressman Scott Peters. It's my great honor to be your federal representative. I know this is a very difficult time for all of us and much, much more difficult for some than others. And I'm really very concerned about the very real hardships many in our community are facing. Obviously, we can't do town halls or meetings, so I'm going to do as much as I can during this crisis to make sure I'm in touch with you and to make sure we are getting you the most up-to-date information, particularly from the perspective of the federal government where I'm involved. My staff and I continue to work every day to do what we can to help you. We aren't taking in-person meetings, and many of my staff are working remotely, but we continue to answer your calls and emails and maintain business hours. The several different agencies and service providers that are involved in the response to the epidemic. Every level of government, every sector of our healthcare community plays a critical role. And tonight I've invited three guests to join our call tonight. First, County Supervisor Nathan Fletcher. His district overlaps with mine. He's the co-chair of the county's COVID-19 response task force. He's going to tell us about how the county is coordinating with area hospitals and healthcare providers. And you'll remember from the fires the important role that the county plays in dealing with emergency response. So we saw that in 2003, 2007. We're seeing that again here, so we're glad to have Nathan with us. Also on tonight's call, Dr. Ollman Saphire, Ph.D. Dr. Saphire is a structural biologist, immunologist, and professor at the La Jolla Institute for Immunology, which has been doing critical work in infectious disease and vaccines for 30-plus years right here in San Diego, and they are now at the center of the global effort to fight the novel coronavirus outbreak. In fact, antibody therapies are often the first therapies advanced for an emerging infectious disease, and the La Jolla Institute will serve as a global clearinghouse to understand which antibodies are the most effective against the coronavirus and to accelerate the research pipeline for treatments. Finally, Mike Sovacool with the Small Business Administration is going to tell us about resources the federal government is making available to small business owners and their employees during this crisis. And later on, he's going to tell us about the small business disaster loans, and he'll talk about how to apply and how they can help. And we'll take as many questions as we can. We may not be able to get to all of them because we have, over 2,000 people on the line. But also, the other thing I want you to be aware of is that things are happening so rapidly. We've just passed legislation, so it may be we're going to have to get back to you after the call, and we'll tell you how to get in touch with us later. So as we face this crisis together, my top priority is your health and well-being, as well as the safety and financial security of our entire community. Now, the only way we can prevent the coronavirus from spreading is if people can get tested and stay home if they're sick without fear of insurmountable financial strain. No one should be kept from following official public health guidance out of fear of losing their housing or their job or their income. Over the last 2 weeks, Congress has passed two different bills to prevent the spread of the virus and to help the country rebound and recover from the effects this crisis is having on the stability of our entire nation. And later on this call, I'm going to tell you more about what these bills do and what's next in the pipeline in Washington. Also, my office has created a comprehensive list of resources from federal, state, and local agencies that can be found on the homepage of my website at scottpeters.house.gov, and we're constantly updating it as we get new information. According to the CDC, there are just under 7,900 confirmed cases of COVID-19 in the United States. 80 of those are here in San Diego, and so far in San Diego, there are no reported deaths from it, but globally, we know more than 8,700 people have died, so we have to take this seriously. And I'm like everybody else, I'll encourage you to follow all guidance from public health agencies. Wash your hands constantly. Don't touch your face. Stay home if you're sick. Practice social distancing or isolation if you're over 65 or otherwise immune suppressed. And call your doctor if you experience some of the symptoms of COVID-19. As I said, the County of San Diego is the designated public health agency here in our region, and now Supervisor Fletcher will tell us a little bit about the county's response. Nathan, thanks so much for being with us tonight.
Thank you, Congressman. And I want to thank you, Congressman Peters, for your help and support. Just today alone, in our role as the Chief Public Health Agency, having declared a state of emergency, which we did in February in response to this, we really are dependent upon all of our partners. Today alone, I spoke with mayors, with federal officials like Congressman Peters, heads of universities, hospitals, and philanthropy business. In every instance when we said we need your help, Everyone has said, yes, we'll help. And I think San Diegans, while certainly anxious about what is happening, should take some measure of comfort that in San Diego, all of our elected officials, all of our business leaders, our hospital leaders, everyone is working together in the spirit of getting it done. When I call Congressman Peters and say, hey, we need to call this company and get this testing device, he does it and helps us. And so we're very grateful for that and for all of your help for us here at the local level. You know, in the county of San Diego right now, we have 105 positive COVID-19 tests. 13 of those individuals are hospitalized. The 105 number, just so you understand, is lower than what we believe it actually to be because of the global shortage of testing. The simple reality is we don't have the testing capacity yet that we would like to have, and we are fighting every day in every possible way we can to get more testing capacity. And there's some things that are coming literally in the hopefully next day or two that will significantly increase our potential. But until that time, we have to continue to be judicious with the use of the test. And I know it's frustrating because I know there's so many folks who want a test, and we would love for you to have a test. But when we have limited supply, it does have to be prioritized. If you're an emergency room doctor with symptoms, we have to test you first. If you're negative, you can go back to work. If you're positive, you can't. But we certainly hope that we can expand that capacity soon. Everything that we are doing from the County of San Diego with our health systems and with all of our partners is designed to flatten the curve. We are trying to slow the rate of spread. We are trying to slow the rate of infection. While it is true that generally speaking, not in all instances, but generally speaking, younger folks without underlying health conditions are not as likely to face the severity of impact of this illness, our seniors, and in particular those with respiratory issues or underlying health conditions, it can be very severe. And so what we're working to do is to slow the spread in order to maintain the integrity of our healthcare system. There's a finite number of respirators. There's a finite number of urgent care beds. There's a finite number of hospital beds. And we don't want to get in a situation like you may have seen in other countries where the demand for those exceeds the capacity. And so all of the orders and advice and things that we're asking folks to do really is designed to flatten that curve so that as folks have a more serious implication because of COVID-19, that hospital capacity is there for them. And we're doing a number of creative things to try and increase our local healthcare and hospital capacity. And those are things that we are doing every day. We have a 24/7 operation that we're working, but there are also things that we're dependent upon the public to help us with, because the reality is each and every one of us have within our power the ability to slow the spread of this disease, of this virus. Little things like washing your hands, little things like social distancing. Those are the things we can all do. And even if you're young and healthy and you think, well, I'm not that worried about it, you don't want to be the one to spread it to a vulnerable person or a senior citizen or someone with an underlying health condition. And so in that spirit, we've issued a series of escalating public health orders. Where we are today with public health orders is we have banned all mass gatherings of 10 or more folks. And so this has been a gradual. We started at 250 and we've lowered down to 10. Those are mass gatherings or any grouping of people that are together in one confined space, that's what we want to avoid because that's the environment that is most contagious. We have closed all alcohol-only serving establishments out of a fear. The reality was we issued some guidance. People should avoid those. It was still going on. We don't want this to be contagious. We've ordered gyms closed. Schools have obviously been closed. And for restaurants, we put in place some changes in operations. There is no in-room, in-facility dining in restaurants. They can still serve takeout. They can still serve delivery. Folks still have to eat. But that is the status of where we are now. And we've issued a series of other orders limiting visits to hospitals and senior centers, congregate care settings, in an effort to protect them from potential spread, along with some really minor things. You're no longer required to get a doctor's note if you're going to miss work or any of that type of thing. And we've done a series of actions around those efforts. Next thing I'll quickly talk about is some of the actions that we've taken to help protect our most vulnerable populations. Those are primarily our congregate care settings, Those are nursing homes, senior centers, homeless shelters, locations where a lot of vulnerable folks all live in close proximity. We've installed 187 hand washing stations throughout San Diego County. We have 96 additional requests that we're in the process of filling in the next day or two. The hand washing stations really are vital for folks who, particularly unsheltered individuals who don't have access to that. We have public health nurses at each of our bridge shelters. We are expanding that to other locations. We also have public health nurses with 9 homeless outreach teams, and we're going to expand that to 16. And then we at the county, as of right now, have secured 1,669 motel rooms. The purpose of these rooms is for any individual who has a positive test, who is a person under investigation, which means they're pending testing, or they are a person suspected of having it who has symptoms, who cannot isolate at home. They don't have the ability to isolate at home. We want to make sure that those folks have a place that they can go and isolate themselves. That could be a senior citizen in a nursing home. It could be a homeless individual. It could be a firefighter who lives in a one-bedroom apartment with 6 folks. But we really want to slow the spread and the contagion, and so we want to have some capacity for individuals who need those options to try and to be able to get them. I want to reiterate, though, that the public health guidance right now is if you feel sick, you don't need to go to the hospital unless you would normally go to the hospital. If you have flu-like symptoms, what we need you to do is isolate yourself at home and treat those symptoms. If you have those flu-like symptoms, just assume that you have it, isolate yourself, have the capacity with friends or family to feed and be able to take care of your basic necessities, and treat the symptoms. There is no treatment for coronavirus right now other than normal things you would take if you had a fever or a sore throat. And again, just reiterating those actions we're all taking: hand washing, social distancing, and if you feel sick, make sure you isolate yourself. And then the final point is that as a parent who also lives in a home, we have a senior citizen, 74-year-old who lives with us. I understand the anxiety and the concern and the frustration that a lot of the uncertainty is providing. And all we can do is just encourage you as best you can that the coronavirus does not detect fear. It does not detect anxiety. Being afraid does not help us from getting it. The only thing that helps us from getting it is channeling that fear into action to follow the advice and follow the guidance. I know the financial strain and stress is immense as we see the huge impacts on our economy. We're taking action locally to stop evictions and foreclosures. Congressman Peters is leading the way federally to provide financial assistance and help. We've created a fund with the San Diego Foundation, sdfoundation.org/COVID, that now has over $4 million that is designed to go to direct assistance to folks that are in need, that have food security issues, need income replacement, can't pay the bills. We are not going to let anyone in San Diego County starve or lose their home because of what we're going through. With our kids, I think the most important thing that we're encouraging folks to do is convey that sense of calm with your kids. We're going to get through this. We're going to figure it out. It's going to be okay. I think we all have a much greater appreciation for the role of teachers now that we have all of our kids at home all day. But we really want the public to tend to your own health and welfare. It is okay to go outside and go for a walk. It is okay to go for a run or ride your bike. It is okay to take your family members to the park and play catch. We don't want your family members congregating with 20 other family members in the same setting, but it is okay to get outside and do these things and tend to your mental health and your physical health and your spiritual health. And then very last point on the flow of information. I meet daily throughout the day with our public health experts, our doctors, our infectious disease department. We don't know what tomorrow will bring. We don't know what the situation will look like tomorrow. And so if we don't know here, your cousin on Facebook definitely doesn't know. And so we're really asking folks on the information. The County of San Diego has a comprehensive website that is really set up to provide a wealth of information and everything that you could ever want to know. It's covid-sandiego.com and coronavirus- coronavirus-sd.com. I'm sorry, coronavirus-sd.com. That has the latest information, the latest stats, the latest guidance. It has a list of resources. And so when you're getting information, I think going back to those original sources is probably the most secure and best thing that we can do as we all work through this together. So again, Congressman Peters, at the county, we're incredibly grateful for your help, for that of your office, and everyone as we work through this. And we're going to continue to provide regular updates on what's happening.
Great. Thank you, Supervisor. And I appreciate your strong leadership. And the good communication has been great for everyone. We appreciate your joining us tonight. Thank you very much. Next, I'd like to ask Dr. Saphire to give us a brief overview about this virus and why prevention is so important, what the outlook is for curbing its spread and finding a treatment. And we're fortunate to have these resources right in our neighborhood. So, Dr. Saphire?
Thanks, Scott. My research area actually is pandemic viruses. And so we from La Jolla Institute head up a global collaboration to develop therapies against these kind of things, to understand how these viruses are lethal, where they come from, how they're folded up, how they work, and more importantly, how we can target a drug or a vaccine or a therapy. So this new coronavirus looks like it spilled over into humans around mid-November. It is a wild virus that came from nature. Probably, the sequence tells us it probably came from bats, but no one's sure. When we have a new virus that comes into humans from wildlife, it's called a spillover event, when it spills over from those animals. So that probably happened around November 15 or so in China, and it took about 6 weeks for clusters of unusual pneumonia to be noted by the medical community there. Many of those clusters were associated with a certain seafood market that's very busy in Wuhan. It did not originate there, but it did spread there, and it could have been human-to-human spread. It could have been spreading from some of the meat that's sold in that market. And so the issue with this novel virus is that it's new. No human has ever seen this before, so no human is immune. We don't have what we call herd immunity. Now, we're not cattle in a feedlot, but we do think about the humans as a herd, and if enough humans are immune to something, it won't spread. It'll be the one match that's already missing from the book so it doesn't spread, the fire doesn't spread from one side to the other. And that herd immunity is what is going to protect humanity in the next 5 or 10 years from this virus. There's so much of it that it might be a permanent part of our human condition, just like all the other coronaviruses that cause common cold. So we have about 3 or 4 viruses, coronaviruses that cause the common cold every single year, and it's about a third of the common cold viruses. And they aren't really much to write home about. You get your normal little fever, runny nose, cough, everybody gets better. In fact, you couldn't get any money to study coronaviruses for a really long time because they never killed anybody. They just weren't simply medically interesting. They only became medically interesting when the first highly lethal one spilled over around 2003, and that was SARS. SARS ultimately infected about 8,000 people and then went away. No one's seen it since 2004, and so it might be extinct or it might be out there somewhere. I think this current coronavirus has gotten too big to go back into coronavirus, Pandora's box, or be squelched. And it might spill back into animals that humans interact with and come back and see us every couple of years. One of the challenges with coronavirus, and the reason why these common cold viruses come all the time, is that your immunity doesn't last too long, just a couple of years. And so when those vaccines are developed, we might be looking at booster shots to try to protect the elderly or the people with underlying conditions if that immunity doesn't last. Okay, so this herd immunity is going to be key to try to keeping these viruses at bay in the future. And we all know that kids aren't getting real sick. And so a question you might be asking yourself is, well, why don't we just send all the elementary kids and all the college kids out and have a massive play date dance party and get it over with while keeping the elderly isolated to build up the herd immunity? And the answer is there's twofold reason why we can't just do that. The first is that it's 0.002% lethal in kids, really low. But there are a couple of kids that are going to be that 0.002%. And we as a society find, that's unacceptable to us. We're not going to cause that to occur. And the second reason is that we can't perfectly isolate all of the elderly or the people with underlying medical conditions. We have generations living together. We have older generations that are being cared for in nursing homes or other hospital facilities by younger generations. And so we need to protect them, for which it's more lethal. And so we need to build that herd immunity eventually, but it's going to need to be over a couple of years. We need to flatten that curve so everyone's not all sick all at once. And we're going to flatten that curve by using the tools we have at our disposal, by just keeping away from each other until we have those vaccines. The virus is spread by droplets, or what are called fomites. So we're learning a lot of new words this year. We learned social distancing. Fomites is another new word for you. I'll start with droplets. Droplets are when you sneeze or you cough or you talk, you send out tiny little droplets of fluid. And they typically fall at 3 feet from you, maybe 6 feet. So if you're 6 feet away from someone, you're not going to get hit with any of those little droplets with virus in them. The other thing is the fomites. You can leave virus on surfaces, and it can live on cardboard, maybe 24 hours, plastic up to 3 days. It doesn't seem to live on copper at all. Copper seems like a good, clean surface. And so if you touch something and then touch your eyes, nose, or mouth, you send that virus in. So if you remember Star Wars, there was a Death Star, and there's actually one way in where the Death Star was vulnerable, and that's where Luke Skywalker had to fly in to shoot that vulnerable spot. Your eyes, nose, and mouth, that's the vulnerable spot in your own personal Death Star. So keep your fingers, that's why they say keep your fingers away from your face. Okay, so while we are keeping away from each other, how are we going to develop those vaccines and therapies? What is the science? There are a lot of different strategies going on right now to do the medicines that we need and the vaccines that we need. For the treatments, we as scientists are trying to repurpose other drugs that we already have. One of the leading ones is called remdesivir. It's made from Gilead. It's a molecule that gums up the works viruses use to copy themselves. It didn't work for Ebola, but it might work for coronavirus, and there's some initial hope. So that's something that's being tested. And there are a couple other molecules as well. For vaccines, there's lots of different strategies. The one that will be first out of the starting gates is using genetic material for just a piece of the virus. So it's totally harmless, but it shows your immune system a copy of something it wants to build a defense against. And San Diego's Inovio was one of the first ones out of the gates to make that kind of thing. Another company, Moderna, is another. There are other kinds of vaccine strategies that are all being tested as well. And so we're going to have those vaccines. We're going to have probably several of them. But the issue is that's going to take some time. It is moving at an unprecedented speed. Typically, a vaccine development would be a 10 or 20-year time frame. We don't have 10 or 20 years. This is going faster than I have ever seen science move before. It's incredible. But the main obstacle now is basic biology, that you can't use a vaccine in healthy people unless you know if it is safe and if it's going to work. And so how do you know if it's safe and if it's efficacious, meaning it's going to work? For safety, people have to volunteer to receive the first couple of doses, and you look and see what happens to them. Those are phase 1 trials, and those have already started for some of the early vaccine candidates. The efficacy takes a little longer. And the reason is that your immune system takes a couple of weeks, maybe 4 to 8 weeks, to develop an immune response against something. And so you don't know if anything's going to work until that 4 or 10 weeks in those volunteers have passed. It's just like if you want tomatoes, you got to plant the seeds or seedlings, and you got to wait for the tomatoes to ripen. And no matter how badly you want tomatoes and how urgently the world needs tomatoes, they're no good when they're green, and you just got to wait until they're ripe and red. And so it's just going to take some time to test those vaccines and mobilize them. And so the goal is to just try to keep the number of new infections at bay until those vaccines can be rolled out. So another question people often ask is, why is this one more lethal? Why are common cold coronaviruses, essentially pussycats, whereas this guy's a tiger? And the reason may have to do with its newness, that no one's ever seen it before. We're all immunologically naive, and that's the word we use. It could be that for these common cold coronaviruses, they all spilled over into the human population 100 to 800 years ago. So we first started experiencing those coronaviruses around maybe 1920 or 1220. And it could have been that at that time, those viruses, when they were new, were also lethal to the elderly and the people with underlying conditions. But think back to 1920 or 1220. Nobody knew what a virus was. The life expectancy was much shorter. There may not have been as many elderly people around. And it may have been that people got sick and died then. But just like now, when the kids mostly get infected and don't seem to notice, kids then too got infected and didn't seem to notice. And those kids turned into young adults who turned into older adults. And then every generation got infected as kids and didn't much seem to notice. And so right now, all those common cold coronaviruses are sort of harmless because we've all seen them before. And the only people that haven't seen them are the people that are just born, the kids. So when it comes around again, they get infected, they replicate the virus, they don't notice much. It could be that 50 years from now, this current virus doesn't look so pathogenic anymore either, because all the kids have gotten it and turned into young adults, then older adults, then elderly adults. And it's only the new kids that think the virus is a whole new thing to them. So how do you kill the virus in the meantime until we get to that point where we have the vaccines and we have safely built up the herd immunity? And the answer is that a bar of soap is remarkably effective. You know, for $1 million, you couldn't go out and buy a coronavirus drug right now, but the bar of soap you got in your bathroom counter is perfect. And the reason that bar of soap is a really powerful thing against this virus is because of the basic biology of the viral particle. It has a membrane on the outside, and that membrane is a real delicate, thin oil-water layer. And just like a couple of drops of dishwashing liquid break up the grease in your frying pan, a little bit of soap breaks up that membrane of the virus. You just need 20 seconds or so to do it. And there's a little science experiment you can do at home with your kids to explain to them what happens when you wash your hands. So you can take a bowl of water, fill a bowl halfway with water, float a thin layer of vegetable oil, olive oil on top, grind some black pepper, sprinkle some black pepper. The pepper distributed in the oil would represent the viral particles, the viruses. Tell them to stick their finger in there. And the oil and the pepper are going to stick to their finger. Okay, send them over to the sink. Have them get their hands all good and soapy and lathery and come back. Now stick that soapy, lathery finger into that bowl with that layer of oil floating on it. And you're going to see that oil and the pepper particles recede away from your finger because that soap disrupts the oil, and that is what happens. And that's how soap kills a virus. And I'm happy to stay on a while and answer any other questions you have about the basic biology of the virus.
Erica, that was very interesting. One of the questions we had was about the length that lasts on surfaces, which you answered. But the other question I had was, do you have an opinion about the governor's prediction for how long this is going to take? There's some varying, to run its course, there's some varying opinions among elected officials in California. Have you paid attention to those?
The opinions vary because nobody knows. They're just modeling based on different circumstances. You can look for some data at China where it was terrible for a while and it's now leveled off and holding steady at an 81,000 cumulative cases. And some fairly draconian distancing measures were put in place. And so how long this is going to take for it to be settled down in the human population is going to depend on a couple of things. How long is it going to take for the vaccines to roll out to protect the frontline medical workers, protect the people that are vulnerable, protect all the other high-priority people, protect everybody? How long those vaccines are going to take to roll out, and how well we can keep apart from each other. The social distancing only really works if everybody does it. If a lot of people are still out mixing and mingling, that virus is still traveling. And that's a challenge. It was easy to send SARS extinct because you spread SARS when you were sick with SARS. And so you know you're sick and you're home. This virus, and also flu, you can spread if you don't know you're infected. And you feel fine, you're out going about your business and not knowing you're shedding that virus. And because we don't have complete testing adequacy yet, we don't know who's infected. And you don't want to be the one jerk that upends what everyone else is trying to do.
I appreciate that. That's helpful. And actually, we had a question for Nathan about whether there's going to be a shelter-in-place order, and he said too that there's no plan for that. But if people don't follow the current precautions, like social distancing, that could change. So That's consistent. Thank you, Erica. If you're able to hold on, that'd be great. We may have questions later, but appreciate your being with us tonight.
Happy to do it.
I know thank you. Many people are worried about and have questions about the financial burdens and what Congress is doing to deal with that. So I wanted to take a little time to talk about that and then get to some questions. So 3 steps. 2 have been taken. 2 weeks ago, the House took the first step, passing a bipartisan emergency response funding package of $8.3 billion of entirely new funds. The President has signed that. That is in law. And that first package commits more than $3 billion to the development of treatments and a coronavirus vaccine. It includes an additional $300 million to ensure Americans will have access to the vaccine regardless of their ability to pay once it's developed. It protects against price gouging of medicines developed with taxpayer dollars, provides $2.2 billion in public health funding for prevention, preparedness, and response, including nearly $1 billion specifically to alleviate the immense financial strain on state, local, tribal, and territorial hospitals and health systems. Protects public health by allowing Medicare providers to extend telemedicine services to seniors regardless of where they live at an estimated cost of $500 million. And it supports small businesses affected by the pandemic, allowing for an estimated $7 billion in low-interest SBA loans to those affected. And we have someone from the SBA will help us answer questions about that. Last week, step 2. House of Representatives passed the Families First Act, and just yesterday the Senate approved the bill and the President signed it into law. The bill is focused on 2 main things. First, ensuring that workers have the financial flexibility to care for themselves and their families, and ensuring that all of us, regardless of insurance status, can be tested for coronavirus at no cost. And if you think about it, we want to make sure that no one is pressured to do the wrong thing because of the financial circumstances of the cost of testing or having to go to work. So with respect to testing, the bill requires that regardless of what kind of insurance coverage you have, or even if you don't have any coverage at all, if you need to be tested, you get tested for coronavirus at no cost to you. With respect to paid leave, the bill establishes 2 types of emergency paid leave: sick paid leave, followed by emergency family medical leave. We want to make sure that no one has a disincentive to stay home if they're sick. If you're sick, you should stay home, and you shouldn't be forced by economics to come to work. So how does the paid sick leave work? The bill ensures that if you work for an employer that has fewer than 500 employees, you have access to 2 weeks of fully paid sick leave to use to self-quarantine or visit a doctor. If you need to take time off to care for a family member or a child whose school has closed, or if you no longer have access to child care, you are entitled to 2 weeks leave, but you may be paid at 2/3 of your salary. Your employer can pay you more, but that's the minimum. If you're an employer wondering how you're going to afford this, how to provide this leave, the federal government will fully reimburse you within 3 months, and here's how that works. Employers will cover the upfront costs of paying out the leave to their employees and will be reimbursed through a refundable tax credit that counts against their payroll tax. And this applies whether you're a for-profit or a nonprofit business. Emergency paid sick leave expenses will be submitted as part of your quarterly tax estimates, and if your cost for providing paid leave is greater than your tax liability, you get the money in cash refund from the IRS. How does the paid family medical leave work? Or the paid family leave work? The emergency paid family leave established by the Families First Act is to ensure workers will not have to miss work to care for their children who may be kept out of school, so that you won't miss a paycheck if your kid's kept out of school and you have to stay home. So this applies to the same employees as the paid sick leave, and provides an additional 10 weeks of paid leave to care for children who are out of school or who don't have access to child care. Workers are entitled to no less than 2/3 of their salary to care for the children. And for employers, the reimbursement structure from the federal government is the same, so you'll be reimbursed for this within 3 months. In addition to free testing and paid leave, the bill provides additional increased funding for people who need food support, whether it's the Supplementary Nutrition Assistance Program or SNAP that helps millions of low-income Americans put food on the table. Also, Meals on Wheels and food banks. A lot of kids depend on schools to feed them, lower-income areas. We cleared bureaucratic obstacles to eligibility for these programs, like work requirements and being physically present to eat your meals. And the bill also increased Medicaid funding to help states respond to the emergency health needs of people who rely on Medicaid. And now, so that's the second package. And now we're working on the big one. That was about $100 billion. Now we're working on a very large coronavirus response package, which we have to enact swiftly to deal with this impending economic crisis. Here's what I think the third package has to do. First, we need to triage. We have to take immediate action to prevent an economic crisis and quickly deploy economic assistance to those who are hardest hit. In our region, thousands of hotel workers have already been laid off and missed more than one paycheck. Restaurants, bars, gyms have been shut down. Those hourly workers have already lost a lot of wages, but they still have to pay rent, and they still have to buy groceries, and we're going to have to find a way to help these people, and soon. Now, this could come in the form of increased access to unemployment insurance, and that might be one component. It might also come in the form of direct payments to people who don't qualify for paid sick leave but can't work because of their place of employment has been shut down. Second, we need to streamline. We need to make sure that we reduce hurdles that will slow the deployment of assistance. We're actually on the government to pay their bills on time so that small businesses aren't waiting. Third, we want to stabilize by offering additional stimulus levers that we can pull without requiring additional congressional action if economic conditions continue to worsen. So we're going to put out a first tranche of money. But if things don't go well, if they continue badly, we'd like to have authorized more without having to come back and vote on it again, because we need to be more responsive and nimble, I think, to deal with this crisis. And fourth, we have to find a way to return back to normal and get everyone safe and healthy and bring businesses back online and workers back into the labor market. And people have raised the issue of the federal debt. I think when we get back to normal, that's something we need to take seriously. But this is one of the times, when in times of emergency, that it's appropriate to do federal borrowing, and I think everyone's on board with that. This is not paying our expenses. This is an extraordinary crisis for the country. We've got a good enough balance sheet that we can borrow this money and help Americans. So I think that's enough from me. I think let's, Mary Ann, maybe you want to talk about how to answer questions and how we address that now.
Sure. Did you want to have Mike from the Small Business Administration jump on, or you want me to go to a question now?
Yeah, if Mike wants to address the emergency loans, the small business disaster loans, I think briefly, that would be useful too. And Mike might introduce himself, and he'll be able to answer some of these questions more directly.
Okay, this is Mike Sovacool, and I'm the Deputy District Director of the San Diego District Office for your Small Business Administration. And on behalf of Ruben Garcia, the District Director, I want to tell you that we're in this fight and that we're here to work with the small business owners to get through this disaster. Your SBA is here to help you start, grow, and expand your small business, and more important at this time, at times of disaster, to assist small businesses through disasters and so that they recover and come out full at the other end. Your Small Business Administration here in San Diego has a very vast cadre of resource partners. Resource partners will provide you assistance in counseling and mentoring and training throughout this disaster. You can find out who those small business resource partners are by going online. The online address for the Small Business Administration is www.sba.gov. Look for the San Diego page, and on that San Diego page we'll list all of our resource partners and how you can contact them. And they're all anxiously standing by to help the small businesses recover through this disaster. Outside of counseling, training, and mentoring, the SBA has established a disaster loan program. The SBA has always had disaster loan programs to meet natural disasters. This is a sort of unique situation where it's a national disaster. And so we have established a disaster loan program. These loans may be used to pay fixed debts, payroll, accounts payable, and other bills that can't be paid because of the disaster's impact. The interest rate on these small business loans are 3.75% for private businesses and 2.75% for nonprofit businesses. The SBA offers these loans with long-term repayments in order to keep the payments affordable, up to a maximum of 30 years. The terms are determined on a case-by-case basis, and they're based upon each borrower's ability to repay. I'm going to tell you how you can access the small business disaster loans. We have a small business disaster loan website. The website's easy to access. You can access it at this website. It's disaster loan, all one word, disaster loan, all one word, .sba.gov. When you go to that web page, there'll be information about the disaster loans. There'll be instructions on what's needed to apply for the loan, and there will be a direct link to start the online application. The time frames are, during the underwriting process, you could expect 2 to 3 weeks. Once the loan has been approved, the loan package will be sent to the borrower. The borrower will look over the loan package, will sign the loan package, return it back to the Office of Disaster Assistance, and once that's received, within 5 days, you could expect payment of the loan. The loans are up to $2 million per business owner. If you apply one time and you don't access all the $2 million, the loan package isn't for $2 million, you can reapply if, in fact, the disaster lasts longer than you originally thought when you made the initial application. I want to give you our general office phone number. The phone number to your San Diego District Office is 619-557-7250. We're here to work for you and with you. If there's anything that we can do to assist you in keeping your business afloat, if you need advice for how to handle business during disasters, our resource partners are all online. How to contact those resource partners are all online, and we'll gladly make the connections if you give us a call at that number. If you need assistance during the loan application process, and they streamlined it and we attempted to simplify it, but if in fact you need assistance during the application process, you can call this district office at the number I gave you, or there's a disaster 800 number that you can call. And that 800 number is 1-800-659-2955. So, Congressman, that's the basic information I got for you, and we can go into more details if the questions require it.
Thank you, Mike. We have someone on the line who owns a small hair salon, and she wants to know, she's very concerned about her salon closing. Her name is Erica. Erica, are you on the line? Erica, are you on the line? Yeah, do you want to talk?
I am a small business owner in Ocean Beach, and I'm concerned about my salon closing regarding the 6-foot social distancing rule. Can you give me anything regarding the salons in San Diego?
Okay. So I think your question is because of the social distancing directive, you're having it causes problems with you providing customer service to your customers. And that
correct.
Yes.
I am a little concerned about the social distancing because we are touching the public.
Correct. And I would say to comply with the social distancing directives, that it pretty much means your ability to conduct business is pretty much shut down, and that your business would qualify for the disaster loan.
Yeah, Mike, maybe to put a finer point on it, I think that's a decision for you, Erica. I mean, the rule is congregating 10 people, and the advice is maintaining social distance. You may feel that that precludes you from doing business, in which case you'd decide to take advantage of the small business loan assistance. But it's obviously you're going to have to be taking special precautions because there's no way to avoid violating that 6-foot advice, I think.
Thank you, Erica. I'm going to take a question from Francisco. Francisco, are you on the line? You had a question about the border.
Yes, I'm here. Absolutely. Of course, the question is, are you guys thinking of closing the border with Tijuana? And more than a question, is more of a request. Do not. The region depends a lot with the other side, but I want to hear from you guys.
Francisco, the border has not been closed. I would note that the border with Canada has just been closed within the last couple of days, and I don't think anyone knows better than San Diego the importance of trade across the border. That's been something that's worth billions of dollars of economic activity to both sides of the border. At this point, there's not an order to close the border, but that's the kind of thing that we're all watching for. We've not gotten that order yet.
We did learn just moments ago, however, that there might be an announcement about the border tomorrow morning that will continue to allow. This is what we're just learning, that will continue to allow trade and cargo to go in uninterrupted, as well as essential personnel. It may look something like the order that was recently placed on the border with Canada and the United States. So trade and cargo will not be interrupted, and essential personnel will not be interrupted, but there may be some additional restrictions tomorrow, is what we are just learning.
Marianne, I have an update. Here we are living this moment to moment. I have a news report that Governor Newsom has issued a statewide stay-at-home order because confirmed coronavirus cases in the United States have doubled in 2 days. His statement is that this is a moment we need to make tough decisions, and he says that the dramatic increase in cases is not just for more testing, but indicates how much the virus has spread. So I think there'll be more detail on that, but this literally just came out within the last couple minutes.
Okay, I'm going to go to Maureen, who has a question about people who are stuck abroad, trying to get back home. Maureen, are you still on the line?
I am.
You want to ask a question to the Congressman?
Congressman Peters, I called your office yesterday, and I was wondering if you'd made any progress with the State Department on sending any planes to get Americans that are being but are stuck in Morocco on tours because Morocco has closed their borders. I think people are starting to maybe get out on Air France flights, but I just wondered if you had any update on that.
Morocco is one of the countries we've been hearing about. We're relying on the administration to help us out with that. We've gotten a lot of calls from people who are trying to get people back from, study abroad but Morocco is one of those areas. We have been calling the State Department. They are trying to work with Morocco, but it is held up, and I can't tell you we have an answer today, but I can tell you that we've passed on a lot of concern from people who are in the same situation as you are, and we'll continue to work on that.
Okay, we're going to go to Noreen. She has a question about testing for people who are not experiencing symptoms but have been exposed. Noreen, are you there?
Yeah, thank you. My question is, because of the spread of people that are spreading the virus and they have no symptoms, what are we doing about testing people that don't have any symptoms but are continuing to spread the virus? That seems to me like that's a problem.
I'd ask
I wonder
Erica
if,
maybe.
go ahead. Sorry.
Erica, if you're still on the line, I wonder if you might offer some thoughts on what the theory of testing is at this point in the spread of the virus. Obviously, we're still working to make sure we have as many tests available as are needed. Erica, are you still there?
Yeah, I sure am. So it's sort of a normal thing that most viruses aren't tested for because we don't have treatments for most viruses. And so usually if you go to the doctor and you say, I'm sick, what they do is try to decide if you have a bacteria or a virus. And if you have a bacteria, they can give you antibiotics. Antibiotics interfere with bacterial growth. They got no effect on viruses. If you have a virus, they say, go home, get rest, plenty of fluids, Tylenol. And so because there's no way to treat most viruses, we only have a few treatments for a few viruses, there wasn't too much to be gained by having tests for that many of them. We have tests for some, but even for seasonal flu, it's pretty common that you just wouldn't be tested, you'd be sent home. Now that said, this one we're worried about spreading to all kinds of vulnerable populations. The issue at the moment is that there aren't very many tests. And if you are negative today, it doesn't mean you're going to be negative tomorrow or negative the next day or negative the day after that. And so if you've been exposed but you're not sick, that test might not tell you anything. It might be that the situation is going to be different tomorrow or the next day after that. And if we're already short on tests, they probably can't test each person 10 days in a row. And so the advice, as long as we're short on tests, is to, if you think you've had a good serious exposure, just stay home and see how you're feeling. It's on average about 5 days, maybe 7, between an exposure and when you get sick. And so if you think you've been exposed, the best advice is to just isolate yourself from other people for 5 or 7 days or longer. And if you don't get sick, you're probably in the clear. If testing becomes widely available, someone who has a known exposure would be high priority, as is someone who's interacting with other people quite a lot. Another thing to note is that a test doesn't fix it. Just like a pregnancy test doesn't change the fact that you're pregnant, and if you waited a little longer, it'd be real obvious that you were pregnant. The other thing to note is that there's a lot of respiratory disease all of the time every year. This year that we're worried about coronavirus, 40,000 Americans died from influenza between October and February. There is so much seasonal influenza and respiratory syncytial virus and just the normal winter crud all of the time every year that there is a 99.99% chance that your symptoms are something else. And most people that have gone asking for a test turned out they had something else. Now, we have to test because you can't control the spread if you don't know who's got it. And the issue with asymptomatic people spreading is that you got to know who's got it so you can keep them away from other people. But as long as we're short on tests, the highest priority are going to be the people that are sick or people that are, for example, a doctor or a nursing home worker.
Thank you. Thank you, Dr. Saphire. Next, we're going to go to Jess from downtown. Jess, are you available? Are you still on the line?
Yes, I am.
You have a question for the Congressman? Yeah, we can. Go ahead.
First of all, thank you for hosting this. This has been great information. So my question is around financial support, and everybody is stressed with paying bills and whatnot. Is there a way that we could pause the financial institutes from collecting payments, as well as maybe the government supporting their workers in the meantime? And then, secondly, is there a plan to work with the credit agencies to help minimize any type of impact to people who can't pay their bills?
Scott, I think you're still on mute.
Sorry about that. Jess, thank you for the question. This is exactly the subject of the discussions we're having right now in Congress. I had an idea that some San Diegans suggested that we provide a 3-month pause on mortgage payments and for homeowners and small businesses, and add the debt onto the back end of the loan at the option of the debtor. So if someone wants to pay their loan, they can, but if they need the relief, they would get that automatically. That seems to me to be the most efficient way to help people who owe money or trying to make expenses. And I know that's being considered in Washington. The other thing is the effort to infuse more money through the SBA or into banks to make loans through the existing channels. I think that would be good. It just seems to me that would be less, not as quick, and I think we need a relief immediately. We are trying to help directly with cash payments to people who are not going to be able to pay their bills, and working with credit agencies to make sure that they understand. I don't think this is going to be much of a challenge, that these are extraordinary times, and that we don't want people having their credit scores harmed. I will say that the state and local government has been good about calling off evictions and foreclosures, and so that's at least the relief is provided on that end. But we're working specifically on your question, and I think we'll have an answer by the end of the week. I don't think we have much more time to wait.
Thank you, Scott. There's a related question from Dana in Poway. Dana, are you on the line?
Yes, I am.
Go ahead. You're on with the Congressman.
Oh, hi. I was wondering what the income limits would be for these checks that we've heard about, and, if that's based on a tax return or how those are calculated.
That's a great question, and that's another topic of discussion. If there's direct payments, I think there's a sense that we don't want high-income people to be getting $1,000 or $1,500 checks. The question is whether trying to figure that out slows down the whole process in a way that's unacceptable. And so some people are of the mind we should just send the money to everybody, even if it bleeds into people who don't need it. Other people would rather wait and make sure that people who don't need it don't get it. I have an intermediate proposal, which is to say that, let's send out the checks to people, and let's say, for instance, it's $1,500, at least, in the near term, maybe another $250 or $500 per kid. And if it turns out that you've made over, say, $100,000 at the end of the year, we would just add that to your tax bill and you'd send it back to us, so that the relief would stay with the people who need it. And if it turned out that you didn't need it, you had a good year, you'd send the money back. It seems to me that that's a reasonable way to draw the line without slowing the process down. But again, this is exactly the issue before us that we're discussing right now. And I think probably would be based on tax, what your tax return showed.
Thank you, Scott. I'm going to ask Maggie from Poway. She had a question also related to some of the tax breaks that are offered in one of these packages. Maggie, are you there?
I am.
Go ahead. You're on.
Hi. Thank you for taking my call. I was just wondering how much, if anything, will be afforded to kids that are 18 and over and are in college but aren't working. Will they be getting any kind of help, or is it just homeowners?
Well, no. In terms of debts, it would be people owe money to banks, I think, and to the federal government for student loans. If it's student loans, yes, the federal government is in a position as the lender to give immediate relief to people who owe money on student loans. So I think on that, that's a fairly easy one to deal with. And we're trying to actually make sure we're adjusting for veterans so that they're not penalized under the GI Bill for not meeting time requirements as well. So that's been discussed. I think most of the other relief is replacing income that you're losing. So I don't know if your college student is working and is losing income. If that's the case, there would probably be relief for the loss of that income to the extent that person is working part-time. And again, details are being ironed out, and we will provide We'll provide resources at the end of this call, and you can always give us a call back to find out what the final resolution is. But again, we should have that next week.
Thank you. Dr. Saphire, we have a question from Anthony in La Jolla. Anthony, are you on the line? This sounds like a good question for Dr. Saphire. Anthony, are you there? Anthony? We're going to come back to Anthony. Sorry about that.
Or you could ask that question. That was a good question.
Yeah, that was a question. So his question, Dr. Saphire, was whether once you've been infected with the coronavirus, can you get it again?
That's an excellent question, and a lot of scientists are looking at exactly that thing. In studies in monkeys, they could not reinfect the animals that had survived. But that's a pretty short-term study, right? We only knew about this virus since New Year's Eve, so that's January, February, halfway through March. So they couldn't have waited that long for reinfection. There are some studies in humans where they saw in China that somebody was negative, meaning they had 2 negative tests in a row by PCR, which is pretty sensitive, but then seemed to get sick again later. And it's not yet known if that was a reinfection or kind of a reemergence. It's called recrudescence. We kind of see recrudescence for viruses like Ebola, other things. And so we don't really know. We do know there's something special that's bad about coronaviruses, that your immunity doesn't last really long. What your immune system does is it makes molecules called antibodies that are like sentries that detect and mark viruses for destruction. And you circulate those antibodies, and that's what provides your immune memory, so you don't get reinfected with something. And those antibodies are what a vaccine would inspire to have on board. The antibodies for some viruses are lifelong. Your measles antibodies, lifelong. Polio antibodies, lifelong. Coronavirus is not so much. They seem to go away. We use the term wane, like the moon wanes. They seem to fade away after about 2 or 3 years. And so that's why the common cold coronaviruses keep coming back every so often. And I think with this virus, we're going to be looking at booster shots every couple of years until we build up enough herd immunity. An important thing, I think, to note, and I mean, it sounds sort of desperate, like, gee, we don't have enough antivirals and we don't have vaccines. And the issue is often that infectious disease is, and especially global infectious disease, is the last thing of interest, that the developed nations are pretty interested in other things that cause disease burdens here, like heart disease and diabetes. But I think it's now really clear that infection somewhere is infection everywhere. And it's important to understand the economic costs of global infection and how little it costs in comparison to make a vaccine. So to make a vaccine for Ebola virus was a fraction of 1% of the cost of that outbreak to airlines, to bridal salons even in Dallas, to the West African economy. This virus is so much bigger than Ebola because it has affected global trade. So many supply chains have things manufactured in China. People's retirement plan values have plummeted. There are people that are going to struggle to keep their business open, all because of a little virus. And the cost to develop that vaccine, the cost to develop that cure, is a fraction of a percent of what this infection is going to cost us. And so it's really important to support that research, and that research comes through your federal tax dollars. And that's tight to get. We have to apply for grants to get that, and there's about a 10 to 15% success rate. So we're struggling to write grants to get funding to the research to protect you. So that's where your tax dollars go. That's a good thing, but it's something we really have to keep focusing on to make sure that we're all protected from anything that happens anywhere in the world.
Yes, and Dr. Saphire, I just want you to know that fighting for the NIH budget has been one of my priorities and is a regional priority, and we've actually raised the budget since I've been in Congress from $29 to almost $40 billion. But people should know how difficult it is to get those grants because it's the best scientists in the country competing against each other for a limited amount of money. So we know that what gets funded is really rock star science, and we congratulate you on doing as well as you do.
Dr. Saphire, there's a question. I know that I've seen this pop up in the headlines in the last couple of days about the effectiveness of hydroxychloroquine, I think it's pronounced. Tamara from Mira Mesa, are you still on the line? Did you want to ask the doctor about that?
Yes. So, hi. So my question specifically is around seniors who have, compromised immune systems, or anybody for that matter with a compromised immune system, if it may be something that we could use preventively in that population, because obviously you have to go out and get groceries. These folks can't be home forever. So I'm wondering if that would be effective, or if that's something that's readily available for the public, if we have enough supply.
That's a really good question, and I'm actually looking it up online right as you were talking, because I don't know. I do say that I see that there's an effort to try to fast-track availability of that. It is a variant of something used to treat malaria, and so it's been used in humans for a long time. And I think what it does is it grabs the iron from the malaria parasite. You can email me later, and I would have more information about how exactly it might work for coronavirus. I think the best thing right now is everything your mom told you. You remember how you always got sick after flying on a plane, and you always got sick after your final exams? When you're tired and you're run down and you're exhausted, that's when you get sick. So the best thing you can do is take care of yourself. Get enough fluids, get enough rest. If you are elderly or immune compromised in some way and you're concerned, this is the time to phone a friend. Give someone else your shopping list and send them out to go stand in line, and they would very happily drop those groceries off for you on your door. Don't be shy about asking for help. And if you want to send someone out for you, just do it. And this is a time where people really should call or email their elderly neighbors or people that they know have diabetes, hypertension, something else, and see if they can go and run those errands for them. Because being out in public is how you might pick this up.
Marianne, there's a question from Maria.
Yes, Maria. Maria from Poway, are you still on the line?
Yes.
Would you like to ask a question? Yeah, go ahead.
My husband and I both work for hospitality. He works at a hotel, but I own my own business. I'm a 1099. I work for a company called Helms Briscoe, and we negotiate contracts. We outsource for big companies, but our clients have completely shut down and canceled and postponed. So my question is, my husband can apply for unemployment, but I can't. So what happens to teeny tiny companies like ours? I don't have a business like a building or anything like that. I work out of my home. What happens to there's a pretty big community in San Diego of us.
Yeah, 90% of San Diegans work for small companies like that. So I think that there will be support for you. I can't tell you the exact form that it will be, other than there's small business disaster loans right now. But we will, if you let us figure out what's happening next week, I think we'll be able to give you a better answer. So keep in touch with us, and we'll take your number and get back to you.
Also, Maria, if you're still on the line, if you could send us an email, and anyone who has a very specific question, I think it's difficult since this is a brand new law for us to be able to answer some of these questions about specific individual situations. But if you send us an email at scott.peters@mail.house.gov, we'd be happy to learn more about your specific situation. And as we get guidance from the various federal agencies about the assistance that's available to you, we'd like to connect you with the resources to make you to connect you with those resources so we know what might apply to you. Let's see. We have a question from John in Mira Mesa. He wants to know what he can do to help. John, are you online? Are you still there? John, are you on the line?
Yes. Yes,
yeah,
hello,
I'm
sorry. Yes, I am.
You're on.
Mm-hmm.
Go ahead.
Okay. I know this might be a little ahead of thought process, but I was thinking, is there possibly a program for community activism or even maybe a volunteer program with in goals in mind of serving the public needs for either like handing out non-perishable and perishable goods or sanitation items or even possibly for immunization efforts, something that's for people that possibly have the free time or who would like to actually help out a little more.
Well, I know, this is interesting because during this call, the governor's issued a stay-at-home order. So what I would have told you is that there are food banks that need shifts, and I know the organization that Nathan mentioned. I'm going to have Marianne look at while I'm talking, she can look up the exact site where we can make donations. I think Dr. Saphire had a good idea about helping your neighbors. It's legit to go to the grocery store, and those people will need help with that. I also had intended to give blood. I assume that they're not going to keep me from doing that. But I think that food security is a really big thing for folks around here. So to the extent you're able to contribute at the food bank, if we're allowed to, or to help your neighbors with groceries, I think that would be it would have an extremely positive impact. Marianne, what's the website for the San Diego Foundation?
I'm sorry, I'm looking for it right now, and as soon as I found it. It's sdfoundation.org/COVID-19. sdfoundation.org/COVID-19. And it is an emergency response fund. It's the fund that Nathan mentioned when he was on the call earlier.
Yeah, they just stood that up. They were aiming for $1 million. They got $4 million. But there are logistical issues, and what I don't know that I guess we're going to have to all find out together is how the governor's order affects our ability to do the hand-to-hand work that we're so used to with volunteering. And I do know that that I was going to sign up for a shift at the San Diego Food Bank. We'll all have to revisit that. Maybe we can put some information about that on our website when we find out. Is that okay, Marianne?
Yes, definitely. We are. Everything is changing so quickly, and I would encourage everyone, as I mentioned at the beginning of the call, to go to our homepage at scottpeters.house.gov and look at our homepage. We are updating the resources and new information there on a daily basis, and we're going to add that one. As well, where you can help out. Richard from San Diego, who has a question for Mike regarding small business assistance. Richard, are you on the line?
I am.
Mike, can you field a question from Richard, please?
Okay.
Go ahead, Richard.
Okay, so I'm a kind of a new security and private investigations and firearms training startup. This is my second year, and just about right when I was getting started, this happened, and I lost, what few clients I had to get me month to month, and I applied for the emergency SBA loans, but unfortunately, while I was asking my question, I think you were giving a lot of valid information that was probably relevant to my situation, and I don't want you to have to repeat things, but I'm kind of looking at what would be the timeline. What the application seemed pretty vague and didn't ask specifics on. Am I going to be talking to somebody directly? These are some things that I was wondering after filling out the application online.
Okay, here. Let me answer your second question first. If you made the application and you submitted your application, that application will go to an underwriter. That underwriter will review that application and should contact you and to talk through the application, to talk through the information you provided, and if at that time you have amendments to make or additional comments to make, that's the time to do it. There should have been if I remember the application correctly, there should have been a remarks block where you could provide information to clarify some of the information that the application asks you to provide. But an underwriter should contact you as they review your application. The time frame. Upon submission, the underwriters generally take 2 to 3 weeks to review the application, go through the discussion with the borrower, and then upon approval of the application, we'll send you the loan packet. Then you as the borrower would sign the loan packet and return it back to the underwriters in the Office of Disaster Assistance. And upon, they're saying 5 days upon receipt of the signed loan documents, disbursement will be made. Does that answer your question?
Someone will reach out to me regardless of the quality of my application, or will they weed out certain people that they feel don't qualify?
They will. If you do not qualify for a loan, you'll receive a declination notice. Upon receipt of a declination notice, they'll tell you to, and they'll give you a reason why it was declined. And they'll also identify, probably this, if you're in the San Diego office, this district office to contact. And then upon that, we'll review with you your package and the reason for declination, and work to see if there was something in the packet that could have been in the packet that might have changed the declination decision. Declination decisions are basically a couple of reasons. One, if your credit wasn't good enough. Two, the information in there did not adequately describe a loan package that would rate the disaster loan, or you're deemed to be able to find credit elsewhere, meaning your business has enough liquidity to it that it doesn't rate a disaster loan. So those are the basic 3 areas in which loans are declined. But if you just recently submitted the application, an underwriter should contact you.
Thank you, Mike. Appreciate that. Next, we're going to go to Michelle from Carmel Valley. Michelle, it looks like you might have a question for Dr. Saphire. Michelle, are you still there on the line?
Yes.
Did you want to ask a question of Dr. Saphire?
Yes, thank you. So I was wondering if there is any data about the virus mutation rate and if that has any effect on coming up with vaccines, and also whether this year's flu vaccine is effective, and if you have been vaccinated against the flu and you exhibit symptoms, whether you should be more alarmed or not.
Those are really good questions. Coronaviruses are unique among viruses of its type in that they actually carry around their own proofreading machinery. So most viruses that have genomes made of RNA instead of DNA, our human genome is made of DNA. Most viruses don't have any proofreading machinery, and every time they copy themselves, they make an error. And they would typically make an error every 1,000 letters that spell out the genetic code, they'd make an error about 1 every 1,000, and that's pretty constant. Coronaviruses make errors much less frequently. So instead of 10 to the minus 4, it's 10 to the minus 6. So it's 100-fold fewer errors. There are some of its molecules that are more prone to errors than others. So essentially, molecules that are required for it to propagate itself don't change so much, because every time it makes an error, it's just as likely to be worse instead of better for the virus. And if it's worse, that virus doesn't grow. Proteins on the outer surface that your immune system sees and respond to are more likely to pick up errors because that helps the virus evade your immune responses. For most of these vaccines, I think that they're going to make so many different kinds of antibodies that will hit so many different little places on that surface protein that we are probably okay. The big shifts that make a vaccine not work are something, for example, that would happen with flu. So with flu, there are entirely different types of molecules in the surface, and just like shuffling a deck of cards, flus can mix and match. And so the vaccine might be really good against molecule H of type 3 and molecule N of type 2, but then once the viruses go off and shuffle their cards and remix and they show up again with H of type 2 and N of type 5, the vaccine is no longer effective. Coronaviruses have a little bit of recombination, but not that much. I think we're not going to be susceptible to the same degree of mutagenic escape for a vaccine. Now, a treatment is different. If a drug binds into some small pocket, the virus could change something in that pocket. And so that's why we need to develop multiple things at the same time. Now, will your flu vaccine work against SARS coronavirus 2, the new coronavirus? The answer is no. Your flu vaccine will keep you from getting the flu, mostly. And the reason I say mostly is because the viruses go off and shuffle their deck, and every year they have to predict what viruses they think are going to come out from the rest of the world and get to America. And sometimes they get it right, and sometimes they get it wrong. You should always, always, always get your flu shot. It is like wearing your seatbelt when you drive your car. If you put on your seatbelt, it doesn't prevent you from getting into an accident, but it means you're going to walk away if you do get in one. And you can't control how everyone else drives on the road. You can only control how you do. It is, I like to say, it's your immunological responsibility to get that flu shot and make sure that you are safe from whatever is on offer this year. So should you get a flu shot when coronavirus is in town? The answer is absolutely, because there is so much more flu out there all of the time anyway. There are 36 to 50 million flu illnesses from seasonal flu in America every single year. So right now we're looking at, in the world, a couple 100,000 cases of coronavirus and tens of millions of cases of flu. Flu is common. Flu is abundant. Flu is out there. You will get the flu. Get your flu shot. And the other reason why that's really important this year is we got to keep people out of the hospitals so that those that contract coronavirus and need that emergency care, there's a bed available for them. If you get your flu shot, then you're not going to take up a hospital bed for that reason. And if you get your flu shot, you are less likely to get sick and get really worried about what have I got. It's just not a good year to be sick. So get your flu shot because it's going to protect you from what is a whole lot more common than coronavirus. I looked up the better answer to the chloroquine question, and there's actually been a lot of research on that. What the chloroquine does, that anti-malarial drug, is it interferes with how the molecule the coronavirus uses to get into your cells is presented and processed. It changes the sugars around the surface. And so it seems like it would actually slow the ability of the virus to infect. It also dampens down inflammation, which is your body's response to an infection. And that might be a good thing because some of the end-stage disease is overexcited, way too much inflammation in your lung. And so if you can dampen that down, you might improve survival. And for that reason, a lot of people with autoimmune disease are already on versions of chloroquine, hydroxychloroquine. Can you get it as a preventative? It looks like medicine is moving that way, and you have to talk to your doctor. There are side effects for that, like everything else, and so they just have to do a risk-benefit weight depending on who you are and what your exposure level is likely to be.
Thank you, Dr. Saphire. We have a really relevant question, a really good question from Chris in Ocean Beach, because I know that here in our office we've been receiving a lot of questions like this. And I know that we are keeping in mind people like Chris who work in our hospitality industry. Chris, you're on the line. Are you still there?
Yeah. Thank you guys very much for having me and doing this meeting. I guess I had a couple of questions. One was there anything in the third package for the bar and restaurant industry? I've lived in San Diego my whole life. Like, I know it is a big part of the industry here. Two, I guess if we don't know how long this is going to take, how are we expected to pay back a business loan when, for me, I'm a bar owner in Ocean Beach. How am I expected to pay back a loan if I can't even open doors to sell liquor? And then, is there any sort of plan for immediate relief for small businesses? I know we've talked about getting payroll taxes deducted and stuff like that. but for a lot of businesses, especially with a stay-at-home order, not just bars but gyms. I know there was another person that had a hair salon.
Right.
How is this? How is this actually going to help us?
Well, it's a great point. And one thing I would say is that Phase 3 hasn't been done yet, and a couple things. First of all, in San Diego, obviously tourism is a big part of our economy, and part of that is bars and restaurants. But throughout the city, bars and restaurants are the most hammered of all the businesses here. And you make an excellent point. So far, Chris, the Senate's proposal, which is on Phase 3, is coming up. We haven't voted on that yet. Is that there is money, but it's all loans and no grants, and there's no specifics on that. The House will weigh in. People like you, who need, who understand they're not going to be able to pay back a loan if you're not getting any revenue. So as I said before, my emphasis is on getting extensions on your need to pay your debts, so that if that's taken care of, you don't have to pay your debts, your employees are taken care of, you have a fighting chance of coming out of the other side of this, and that's what we're going to be working on. And I really appreciate your mentioning that, because I think that's a very well-placed concern. And the answer is, right now, it's not taken care of, but that's my job and the job of the House to make sure that folks like you are taken care of, because I understand that situation is not helped by even a low-interest loan.
Hey, Congressman, this is Mike from the SBA. For those disaster assistance loans, there is an 11-month deferment for payments, and so the payments for that disaster loan does have a deferment period if the borrower elects to choose it.
Oh, that's helpful, Mike. Thank you. Appreciate that. Okay, Marianne?
Yes, I'm here.
You have another last question, or?
Yes, one last question. I'm sorry, I just lost it. Here it is. Catherine in Pacific Beach. She wanted to know about efforts for members to vote remotely. Catherine, are you online? Are you still there?
I am.
You're on the line. Go ahead.
Okay. Yeah, I actually had a few questions. I couldn't quite hear which one you mentioned, but one of mine had to do with the reports I've heard about the lack of face masks and other personal protective personal equipment, I guess it's called, for the nurses and doctors, so that they're protected. And I was wondering if there are any local businesses that may have closed their doors that could be converted to producing that sort of thing, just because that seems like that will be extremely critical.
Unmute.
First of all, if anyone knows of businesses that want to help make personal protective equipment or ventilators, they should reach out to us. We'll try to connect them with the right people in government. The issue now is we have been requesting the federal government make these available from a national defense storage that they have, and they said that, I guess they gave word today that they're going to do that. It is really a critical issue. I have talked to one hospital in the county who's only got enough masks until this weekend. So, that's just unacceptable. And so, we have been trying to prevail on the president to use his executive powers to make masks available. We think he's finally responded, and we're going to try like crazy to make sure that we get those supplies here. We understand that that's an issue. The other thing I would say is that I know that 3M and some of the other manufacturers have been doubling, tripling their production. So again, I think this particular thing will be a short-term one, but it's really critical today and this week.
Thank you. Thank you, Catherine, for your question. I know that we still have more people in the queue with questions, and as I'm looking through them, a lot of them are very specific to your situation, whether you're a small business owner or you're seeking unemployment insurance. And I think those are questions that we're going to have more answers to as we get more guidance from the federal agencies over the coming days. So I'd ask that if you had a question like that and we weren't able to get to your question tonight, if you could please send us an email at scott.peters@mail.house.gov, or you can leave us a voicemail at 858-455-5550. I know that's a lot of fives. If you go to our website at scottpeters.house.gov, all of that information is there as well. We are still answering your phone calls and returning your emails and processing casework, which is what we do here in the district office to make sure that if you have questions or concerns or need help with the federal agency, that we connect you and try and be your advocate. We are also fielding a lot of questions from people who are not able to get home. They've traveled abroad, and we are working with embassies and the State Department to do whatever we can to try and connect those people with flights home. Thank you so much, all of you, for hanging on with us tonight. I hope that you got some good information, and we were going to do our best to be in touch with you over the coming days. Thank you again to our special guests, too, for joining us, and we'll talk to you next time.